series for the next for the 4 Mondays of November. We're going to be learning about different topics with mental health, kind of defining them, what they are, why they happen, a couple of quick resources and things like that. And we know that we called it Stronger Through the Season because we know during winter, getting closer to the holiday seasons, mental health can start kind of spiking and increasing a little bit. You'll see a little bit of an influx on the bell curve. So we thought we should talk to people about this, give them some tools and some understanding about it. So that's what we're going to do. So I'm going to minimize my chat. I'm going to start this off. Mokwaone Janine Dijnakas, Lake Manitoba Narrows Ninda, B'nai Muteng Dunjiba. My spirit name's Bear Paw Man. I'm from Lake Manitoba Narrows in Manitoba, which is about 2 hours north of Winnipeg. I'm a band member of B'nai Muteng First Nation, which is about 2.5 hours north of Winnipeg. And my GST name is Tyler Geisler. I learned that from an elder when he introduced himself one time in Ontario, and I've really liked that. It's pretty funny. So my GST name's Tyler Geisler. I'm a social worker by trade. I got my master's from Dalhousie University. I work as an education liaison with SE Health, where I've been for about close to 7 years now. And then I also have a private practice as a mental health clinician in different communities in Manitoba. Aside from that, I'm a father of 5 sons, all between the ages of 6 and 12. I don't know if they make me more stressed or more happy, a little bit of both. I've got more gray hair, definitely, since I've had them. So that's who I am. And then over with me, underneath me in my screen is...
Good afternoon, everyone. Shout out to Willard Pine for the GST name. It makes me laugh every time. Good afternoon, everyone. I'm Doris Warner. I'm engagement liaison. Oh, I'm Tyler now on the screen.
Oh, geez, sorry.
Jumped
I
back.
clicked on the chat. Yeah.
That's funny. Anyways, I'm an engagement liaison with the SE Health First Nations Inuit and Metis Program. I've been in this role for almost, just over 14 years now. I am a lifelong ally, and yeah, I really had the honor and privilege of working alongside First Nations, Inuit, Métis communities and organizations for more than 35 years now. And my top role, of course, is as a mom. I'm a mom of one. She's 27 and a nurse and living her wild dreams out in Victoria, BC. I see we have some in Victoria joining us today, and one of the most beautiful places in the world. So yeah, I'm happy to be here today and supporting Tyler. So thanks.
Awesome. Thank you. Thank you, Doris. I think everybody knows that this is being recorded, just so everybody knows. But we're going to move forward with our land acknowledgement. Just start by acknowledging the many First Nations, Métis, and Inuit who have lived and cared for these lands for generations. We're grateful for the traditional knowledge keepers and elders who are still with us today and those who have gone before us. We're lucky enough to work from coast to coast to coast all throughout Canada. It's really nice to see a lot of familiar names on our chat. Hey, Candy Edwards, I see you in Sioux Lookout. I see a bunch of other familiar names. I wish I could say hi to you all, but we have the interest of time. I'll only get you guys for another hour. So disclaimer, we're going to be talking about anxiety today. If anybody has any anxiety disorders or difficulty with it, or mental health or substance misuse challenges they're going through, just step away if you need to. If you wanted to talk to me or Doris after, by all means, you can reach us by email or phone or whatever you needed somebody to talk to, but just take your time. Don't want to have this a super triggering event, which I don't think it will, but we just like to make sure of that. Some of the core concepts, we're going to be talking about anxiety, the definition, the characteristics, the common types of anxiety we should be watching for, and how it can impact us. We're going to be talking about a few coping mechanisms near the end as well. This is only a quick 1 hour lunch and learn. This topic deserves to have a lot more time assigned to it. So this is just quick lunch and learn for you to have some light bulb moments, some ideas and things like that. If you have any more questions about the topic, please holler at us. We'll share our information at the end. First and foremost, we're going to do a quick Kahoot. So what I'm going to do is I'm going to close that screen, minimize that screen. I am going to close my chat. I'm going to blow this up and we're going to start. So everybody go on your phones. Usually when we do workshops, we don't want people on their phones, but I want everybody on your phone for this workshop. Go to, as you see on the screen, kahoot.it. So you're going to go to your internet browser, go to kahoot.it, www.kahoot.it. and follow the prompts. Sarah's already in. PJ, Patricia, look at this. Amazing. These people have done this before. And then you enter the game pin, which you see on your phone. It's or on the screen here, 235-7747. Look at this. We've got people from all over the country joining us. We've got Grant. We've got Tia. We've got Lori, JMJ, Ramel, Lori, Kelsey, Crystal. Nice. Keep coming. Keep on coming. We had 200 and some people sign up for today, so let's get everybody in. We've got Buttons. We got Stephanie Land. We got Jenny. We'll give everybody another few seconds until we start. Let's turn up the music, set the mood. Awesome. So everybody in 10, 9, 8, 7, 6, 5, 4, 3. Oh, Bert got in. Amanda 2, 1.5, 1.75, and here we go. Boom. Okay, just follow along and answer best as you can. We don't track your answers or anything like that. We're just getting a synopsis and understanding of what everybody feels. Pin your answer. So how's everybody feeling today? So there's going to be a pin you can put on one of the faces. How are you feeling today? Put your pin down. Three, 2, 1. Let's see how people are feeling. So a few people feeling meh, all the Nicolas Cage faces. Some people carefree, relaxed, happy, excited, focused, stressed. Somebody's got a little bit of anxiety, bees, angry, right? All emotions are appreciated. All emotions are good and needed at some points in our life. Okay. And just like that, we've got a leader. Crystal's leading at 8:58, followed by Ivy at 8:53. Next up, Word Cloud. Where are you joining us from today? Where are you from? Five, four. Keep them coming. Keep them coming.
There's that
And let's
beautiful map.
see. We've got people from PA, Sioux Lookout, Skowhegan, Oneida Nation, Thunder Bay. So whatever the biggest word is, that's what people answer the most. So we have most people from Thunder Bay, Winnipeg, Saskatchewan today. We got people in Thompson, Quebec, Estevan, literally people from all over. It's nice to see British Columbia, coast to coast. I think we had some from Nunavut and Yukon. But yeah, I'm pretty sure I've seen that in the chat. Awesome. Great work. When you hear the word anxiety, what comes to mind first? You hear the word anxiety. What are you thinking? And the answers are coming in. This probably didn't need a full minute time, but we'll give it that. 66 answers. Keep them coming. 67, 68, 69. I just said, oh, well, I said 67, but this whole craze of this 6-7 with these kids is like mind-numbing. Okay, we're into the 70s. 5, 4, 3, 2, 1. Turn this down a little bit. 72 answers. We show answers. Fear, stress, yes. Jitters, overload. That's a really good word. Panic, nervous, messed up mind. Yes, fast heartbeat. 100% for anybody who's experienced anxiety. These are very, very common. Racing heart, worry, chaos. Your mind is just messed up, right? There's an overload. Awesome. Great answers, everybody. How many people experience anxiety disorder in their lifetime in Canada? Take a guess. 1 in 100, 1 in 4, 1 in 25, 1 in 10. Three, two, one, and let's see what people chose. 1 in 4 is the correct answer. So 51 people answered 1 in 4. You got it correct. That's 25% of our population. So if you line up 4 people and you pick at one of them, one of those 4 is going to have an anxiety disorder in their lifetime. So it's a very, very common thing. Okay, let's see that leaderboard. All of a sudden, Kelsey's hopped ahead at 1,742, followed by JMJ at 1,736. Okay, word cloud. When you feel anxious, where do you feel it? Is it in your mind, in your body? Do you get sweaty? Your hands tremble? Where do you feel it? This music is anxiety inducing. It's like if you get it wrong, you're going to get in trouble.
I feel it everywhere. The music's
Yeah.
giving it to me.
Mind, heart, body. Yeah, your tummy, right? Some people get very upset stomachs. Look at that. The big words again is chest and stomach, right? So it shows how our mental wellness is directly affecting our physical wellness as well, right? So we have to make sure our mind, spirit are all taken care of to make sure that our physical body is taken care of as well. We've got gut, heart, whole body, chest blocking, hands, chest, and head, right? It's everywhere. It literally impacts us physically, right? Very, very good answers. We only got about 3 more. What's something that usually helps people calm your anxiety? Or how do you calm your anxiety? What do you do to help yourself or help others? Four, three, two, one. I'm interested in these answers. Grounding, yes. Breathing, distraction, yes. Breathing is a huge one, and I'm going to tell you why breath work and breathing impacts us. Feeling breath, petting my dog. Dogs and pets are the best, right? And they can tell usually right away when you're not feeling well. They come and cuddle up close to you and put their nose in you. They know something's up, right? Because we exude that energy, right? Mindful breathing, listening to music, very good answers. As we see everything highlighted in green, it usually says breathing, grounding is really important. Very great work, you guys. Very, very good. Okay, next. True or false? Anxiety can be helpful sometimes. Can anxiety be helpful? Answers true and false, right? Depending on maybe your experience with anxiety, you're like, no anxiety can be good at all, especially if you're maybe dealing with it. Just keep it all away. But in all honesty, anxiety can help you sometimes because you do need a little bit of worry in life, right? If you're not anxious about driving on wintry roads that are super icy, you're just going to fly 100 kilometers down the highway, right? That anxiety makes you worry a little bit and makes you a little bit cautious of those winter roads, right? So it does serve a beneficial purpose sometimes. Okay, and all of a sudden Tina is taking the lead over Kelsey. Okay, and true or false? Deep center breathing can physiologically calm anxiety by activating the parasympathetic system. Look at these answers. Thank you, Janet. 4, 3, 2, 1. And it is true. Yes, that deep breathing that all of you answered a little bit earlier can certainly activate something known as our parasympathetic nervous system, which we're going to touch base on today. And then Crystal has reclaimed the lead at 3,669. Final question. What's a common workplace factor that increases anxiety? Which one of these increases your anxiety? Unclear expectations. That is a huge, overwhelming response, right? There's peer support, clear communication, team appreciation, but 100% unclear expectations in the workplace. They set the bar this high and they change things on the go and things like that. That's really difficult to work in. So very good answers. Let's see the podium. In third place, we have with 45 points, JMJ. Everybody give a clap for JMJ. Kelsey gets snaps. And in first place, Crystal! Good job, everyone. Crystal, you get emojis from everybody. A celebratory emoji, if anybody wants to put into the chat. Put a celebratory emoji. Pick one from your keyboard. I'm just going to refix my screen here to reset it. Give Crystal, good work, everyone. Give Crystal an emoji that she deserves for. Thank you so much. You guys had great answers. Okay, I'm just going to double check that. Great. Look at these emojis. Awesome. You guys are the greatest. Okay, so let's get the show on the road. Very good answers, everybody. Just kind of getting a general synopsis of everybody's feelings towards anxiety, what helps, what doesn't help. So just like we said earlier during the Kahoot, is anxiety, it happens to everybody, right? Anxiety is a part of life, right? When we talk about disorders, it's a little bit different, but just like it says here, it keeps us staying alert, focused. Like when the roads aren't very good, or our baby, if we're looking after a little baby and they're walking on the stairs or getting close to some stairs, boom, our anxiety triggers and we run to make sure that our baby is okay, right? Short term linked to specific situations. If we have anxiety over things like bills and financial stuff, that is all fine. Okay. So anxiety disorders are different, right? They're more intense, they're persistent, and they're overwhelming, right? This is it can occur without any clear triggers, right? We've worked with these people, we might have been these people, we might have people in our families and our friends who have anxiety disorders where they're just a bundled up ball of tense energy, right? They're just scared all the time, or they're anxious, or they're worried. And even though their life seems to be okay, they've got a good job, they've got a roof over their head, they've got food on the table, there isn't any significant trigger, they still are this bundle of nerves, right? And that is an anxiety disorder for a lot of these people, right? And it comes with, as you can see, is the symptoms are things like rapid heartbeat, muscle tension, fatigue, insomnia. And for some people who have never experienced anxiety, it might be difficult for us to understand where they are coming from, right? Why they're that ball of nerves all the time, why they're always anxious and worried, right? But we're all wired differently. In the DSM-5, which is the Diagnostics and Statistical Manual of Mental Disorders, sorry, tongue twister, what the DSM is, it's a manual with all of the mental disorders, with all the researchers and physicians and psychiatrists and psychologists who work on this and update it every few years. And it has all the mental disorders kind of known to humanity in there, right? So there's anxiety in there, there's depression, there's gambling addiction, there's everything, schizophrenia, there's bipolar disorder, right? So what they say for generalized anxiety disorder, we're talking about disorders now, is excessive anxiety and worrying occurring more days than not for at least 6 months. So and they also have to have the following symptoms with at least some of these symptoms more days than not over the past 6 months. So some of the symptoms are persistent and excessive worrying every day about life events, difficulty controlling worry. They might be restless. They might have fatigue where they're tired, difficulty concentrating. They're irritable, right? When you see them, they might be shaking, right? Some people you see in your life, you can tell even when they're eating with maybe a spoon or a fork, they're kind of shaking, right? They have muscle tension. They have a difficult time falling asleep. And if they do fall asleep, they have a difficult time remaining asleep, right? Impacts daily functioning, work and relationships, meaning They have a really hard time getting out of the house to get to work. They have a hard time getting out of the house to see other people, or maybe you invite them out to a social function and say, hey, do you want to go to a hockey game or a baseball game, or do you want to go to a restaurant and get something to eat? You invite them, and then maybe at the last minute they say, actually, no, I can't come, because they had the good intention of trying to come, but in that moment, once the time actually comes to go on that date or to go on to that lunch date with you, they might be a ball of nerves, right? Or their anxiety is kind of influxing and increasing, where they're thinking, I can't do a lunch date right now. And then they cancel on you. And that might actually become a bit of a trend that you might see, and you think that they're just dismissing you and maybe you're upset with them, right? But it could be because they have an anxiety disorder that prevents them from coming out, right? So we always have to be mindful. People might be going through these things before we're making any judgments, right? Just going to check the chat. Chat is all good. Great emojis. Furthermore, to generalized anxiety disorder, anxiety, worry, physical symptoms cause clinically significant distress or impairment in social, occupational, or other important areas. And these disturbances aren't attributed to physiological effects of a substance, right? So, generalized anxiety disorder, somebody might be nervous because they're on a certain medication or they're using a certain substance or whatever it might be, which increases anxiety, right? Generalized anxiety disorder isn't brought on that; it's from other avenues, right? Disturbance is not better explained by another mental disorders, right? So aside from generalized anxiety disorder, there's also social anxiety disorder, which we hear a lot, especially me. I work a lot with teenagers in different communities, right? And it seems like there's this super high spike of social anxiety with teenagers, but not only teenagers, I would say adults as well. And I think there's probably a little bit of a trend from COVID a few years ago when people were kind of isolated for up to a year to 2 years. But aside from that, we're further isolated because we're on things like our phones all the time, right? I talk to my friends all the time. I don't know, sometimes you might not see them for a few months. You felt like you've seen them, but actually going into big social situations now are getting increasingly more difficult for people because we're always at home communicating with people over laptops, over phones, and not actually person to person, right? So social anxiety is just like you see on your screen here. Fear of social situations, fear of negative evaluation, right? So you're fearing once you go into a social situation, you go for that lunch date with you and your friends, right? And they say, you know what, where have you been? I haven't seen you for a while. And you're scared that those questions are going to come at you, or they're going to judge you, or maybe they're going to see you shaking a little bit, right? Maybe you have physical tremors from your anxiety, and they're going to be like, "Oh, how come you're shaking like that, man? Settle down," right? All of that stuff really scares people, right? And they go through these situations in their head constantly before they go out on that lunch date, before they go to that sporting event or wherever they're that family gathering, right? They go through these things and they wind up their anxiety to the point where they make it difficult to actually get out, right? And it's just part of the disorder. So, like I said, it's really good to be mindful of that. Will you be emailing us the PowerPoints? Um, yeah, there'll be recordings. Kelsey's got it. Thank you, Kelsey. You're the greatest. Um, so yeah, that's with social anxiety disorders, right? Is we have to be mindful that people are going through different things as well. They're persistent and impairing. They make it difficult to get to family gatherings. They make it difficult to get to work. They make it difficult to get with friends. Then what happens is you're further isolating yourself, right? It's kind of like a catch-22 that if you go out, you're scared you might get judged and your anxiety is gonna blast through the roof and you're gonna look like you're gonna look like you're going to look funny in front of your friends. But if you don't go to your friends and you don't go to your family and see other people, then you're going to be socially isolated and stuck with your mind in your bedroom or your living room at home. And then isolation is also not a very healthy and positive coping mechanism to get out of that bout of anxiety, right? So it's kind of a give and take, a yin and yang kind of thing, right? Uh, Social isolation is really, really bad. You've got to get people out, but that's a whole nother conversation we got to have. Aside from generalized anxiety disorder and social anxiety, there's panic disorders as well, right? That's the things we call like panic attacks. That's all part of anxiety. That's all part of your sympathetic nervous system that increases cortisol and puts you on high alert. Once it gets overwhelmed and it peaks to a point, just like a pot boiling over, right? If you have a boiling pot of water, you can let it simmer and that's okay. But if you close that thing and turn up the heat and never turn it off, it's going to blow and boil over, right? Just like a pressure cooker. And when it blows and boils over, that's just like a panic disorder. When our anxiety spikes, we end up having a panic attack. We can't breathe. We think we're having a heart attack. We can't think, right? And what a panic disorder is during a panic attack, you have four of a list of 13 possible symptoms, right? So there's the palpitations, there's sweating, you're trembling, you're short of breath, you have chest pain, you're nauseous, you're dizzy, chills, heat sensations, you're having hot flashes, right? So all of these different things, you feel it like you're losing control, right? You think you're going to die, right? I've never had a panic disorder. I've been present when somebody else has had one, though. I've listened to many people who've had them. And that's what a lot of them say is they say, I honestly thought I was going to die. I thought this is my time is up. I'm having a heart attack. And then once your body kind of regulates itself and they come back out of it, they're like, oh my God, that was so scary. I don't want to have that ever again. Right. So, furthermore, to panic disorders, at least one of the attacks is followed by 1 month of one or both of persistent concern or worry about having another attack, right? So once you had that first attack, you're worried you're going to have another one. The next one's coming right away, right? It might not come for a week or 2 weeks or a few months, or it might never come again, right? You might have a panic attack once in your life or a couple. Doesn't necessarily mean you have a panic disorder. Panic disorders happen more frequently and more consistently, right? And then it says the panic disorder, because you're so worried about having panic disorders, it changes your behavior where you start avoiding things, right? You don't go to that family gathering. You don't go to work. You don't drive your car because you're scared you might have a panic disorder or a panic attack, right? So it really inhibits and impairs your ability to live life to the fullest. Just going to double check the chat. Thank you so much, everybody. And by the way, Crystal, I'm going to get to your chat right away. I just want to thank everybody for you sharing here. Everybody be very mindful that if people are sharing, it's really difficult to be vulnerable. And if they're being vulnerable and letting us know what might work for them or what they struggle with, by all means, we will try our best to kind of keep it within our learning circles here today. So Crystal's slides would be very helpful. Thank you. My legs felt like cement pillars, making it horribly difficult to walk and horribly exhausted afterwards. Very good. Thank you, Crystal. Thank you for sharing. So we went from generalized anxiety disorder, social anxiety, panic disorders. Then another branch of anxiety is phobias, right? So there's arachnophobia, right, which is you're scared of spiders. There's agoraphobia. Agoraphobia is you're scared of open spaces and large crowds, right? When you're in a large crowd, you get this phobia, panic attack comes, and you're a little shell of yourself, right? So just like it says, phobias are marked fear, just like it shows this beautiful mountain range here. There we go. It's playing nicely. Um, could be like a fear of heights, right? We all have fears, but phobias are something that actually induce anxiety, like significant anxiety. So I've been on flights with people where they're vomiting and throwing up because the anxiety of flying is so gut wrenching and so nauseating, right? And it's such a phobia for them that they literally have physical symptoms, just like you all shared in the Kahoot, right? I said, where do you find anxiety? Gut, chest, all over, right? My hands trembling, things like that. It literally impacts us, right? So phobias are where it actually spikes your anxiety significantly. Fear of something is a little bit different. We all have fears, right? If a what am I scared of? I don't really know. I'm not scared of too much, so I can't really give an example, but I think you get the gist.
I'm scared of jumping
Aside
off the
from,
dock.
are you
Yes, it's so
scared of?
irrational. I jumped off the dock as a child all the time, and now I can't. I couldn't jump off a dock. I couldn't do it.
Yes. And
No
Justine
reason
says
for
here,
it.
yes, 100%. And yeah, there's no reason for it, right? And Justine says here, blood, right? I remember one of my first jobs, I worked in a restaurant and I was cutting something and I accidentally cut my thumb. And the owner of the restaurant was right beside me and she almost like boom, like fell backwards. And just from that little bit of blood on my thumb, she almost fainted, right? And yeah, that's a good one, Justine. Terry said, stop watching shows or movies or reading books that you have been able to interact with before. Yeah, 100%. Further anxiety disorders is something like selective mutism. I've worked with people with this as well. What selective mutism is, just like it says, mutism being mute, meaning um, they can't talk in your presence. You might ask them, if Tyler had selective mutism, you might say, Tyler, how you doing today? And I'll just be 0 words. And people with selective mutism, they get even further anxiety because they think you're judging them because you think they're rude now because they're not talking back. So it's just this snowballing effect, right? But they literally just shut down and go mute around people, and they'll only say brief, specific words to very, very close people to them. Maybe their father, their mother, maybe a teacher if you're lucky, maybe a couple friends, right? And when they do talk, it's very few and far between words, right? But selective mutism is an anxiety disorder, separation anxiety disorder, just as it's mentioned, right? A lot of people struggle with this. I work with a lot of teenagers and youth as well, not just teenagers, but around 8, 9, 10 years old. Things like have a difficult time sleeping over at their house. Say if their parents go for a date night for one night and they have to sleep with the grandparents at their house, they can't sleep at grandparents, or they can't sleep without their mom and dad. Or if mom and dad don't even leave for the night, it might just be a few hours, they get panic attacked, right? They get super anxious. Mom and dad are gonna be in a car accident. Mom and dad aren't coming home, right? And these are the kinds of things that it sounds almost far-fetched, like I'm making this stuff up, but I've heard a lot of these things working with people where their mind just goes to the worst possible scenario and worst possible case when they are worrying about these day-to-day lives, right? And that's anxiety, right? And it's all about resetting our expectations and our mindsets and understanding that we're usually safer than what we give ourselves for. And then there's anxieties disorders due to other medical conditions. Um, I have a family member who has a lot of anxiety now due to a medical condition he's just went through. And just anxiety has spiked off the roof. Never was that bad before that medical emergency. So these things can happen as well. Just going to double check the chat. Pushing a shopping cart. I always think it's going to hit somebody and I will fall with it. Thank you, Sheila. You better not be hitting the back of my ankles either, Sheila. I know those people too who hit the back of my ankles with their cart. But thank you for sharing 100% though. But yeah, even that, you're pushing a shopping cart, you think you're going to hit something and you're going to fall with it. Like that's a lot of things that actually has to happen, right? Before it actually happens, right? And all of that, your brain is snowballing. What happens if I push a shopping cart? I hit somebody and then I fall with it. Like that's a lot of things and it sounds real, like kind of irrational, but this is what can create spikes in anxiety, right? And we have to think, even if you did do that and you did fall, what's the worst that can happen from that? You all laugh at it, you get up and go again, right? In the end, the consequences, even if all that did happen, the consequences aren't that bad. So we have to think of the consequences. If everything that did happen isn't even that bad, why are we giving it so much power, right? Evelyn, 100%. I've developed a ridiculous fear of wind, serious grounding, and mind. Awesome. Thank you so much, Crystal. But even wind, right? It's like this anxiety of wind. Feel more like young people have problems talking on the phone to people. Yeah, 100%. It's all text now, written words, text, right? They have a really hard time talking on the phone. So misconceptions, it's all in your head, right? People say, that anxiety is just all in your head. I've heard of people like that, family members, friends, just general public where they say, that guy's got anxiety or oh, he's got depression. It's just all in your head. You can just get over it. Reality is anxiety is a whole body experience. Just like in the coot, you said it's chest pain, it's stomach, it's nauseating, right? It involves our nervous system, our hormones, our brain. There's neurochemicals that are impacted in our brain. They get flooded throughout our body, and then it actually affects us, right? People with anxiety can't handle stress. That's not necessarily true. We all have anxiety. Even people with anxiety disorders can still handle stress, right? But they might just have different symptoms than other people have and coping mechanisms, or maybe it's called allostatic load, actually, how much they can actually take. It's not a character flaw, as it says here. It's a natural biological response that can become overreactive due to genetics, trauma, or chronic stress, right? So depending on your genetics, trauma, chronic stress, we are all prone to anxiety, right? If you are constantly in some places around the world are very war torn right now, right? They're going through wars. They're being chronically put through traumatic experiences, right? If I took each and every one of you and I placed you in that for the next 5 years, you would come out a ball of nerves as well, right? You'd have anxiety, right? I shoot fireworks. I went and got training for commercial fireworks, and we were in Winnipeg and we were shooting fireworks. They said they got approval where I was getting trained, right? And the fireworks were shooting at 2 o'clock in the afternoon. And this trainer, like you said, he got all the right permits to do that. But all of a sudden, this elderly lady, she probably looked like in her 70s, came out and gave the trainer heck in that park because she said, you guys should have gave the neighborhoods warning because you know what? She lost a family member to something explosive, right? And all of a sudden, she started hearing this explosion, these fireworks going at 2 o'clock in the afternoon, even though you can't see them, right? But just all of a sudden, hearing these explosions at 2 in the afternoon rattled her. Anxiety spiked, right? And it went back to this traumatic experience. So just things we have to be really mindful and how we all have different triggers, right? Some things we have that might seem very innocent might actually trigger somebody, right? More misconceptions. I gotta get through this. We only got 21 minutes left. You can just relax or think positive. So it's not always that easy. Obviously, there's coping strategies and things we can do to reduce anxiety that will work, but it's not always just relax, think positive, right? It changes us, it changes our mind, right? And to change our mind into thinking positively when we're used to always thinking maybe negatively or the worst situations, it takes time and it takes effort, right? Just like one of the one of the types of intelligence. There's mathematical intelligence, there's linguistic intelligence, there's physical intelligence, there's musical intelligence. There's also something called emotional intelligence, right? And say if I want to become a good mathematician, I'm not very good at math, but if I practice math, practice math, I'm going to get really good at math. If I'm not very good at guitar right now, but if I practice guitar, I'm going to be good at guitar. But if I only practice guitar once or twice, 3 times here and there, and then I take a break from it for the next couple of years, I'm going to be back to day one. That's like our emotional intelligence and working with anxiety and things like that. It's got to be a constant thing you're working at emotionally, right? If I want a physical body like Arnold Schwarzenegger and to be buff, I can't work out for 1 month or 2 months and think I'm going to be buff like him. I've got to do it consistently all the time for years, right? And then I'll get that body like him. And that's just like our emotional intelligence as well. We've got to work on it daily, weekly, and keep it going for the rest of our lives. More misconceptions. Medication is a sign of failure. That's a crock. Medication helps. So do other things as well. There's other things too, like the co-occurring disorders initiative, which is you have co-occurring disorders. That might be mood disorders like anxiety or depression, which is also paired with a substance misuse, right? So what came first, the chicken or the egg? Meaning, some people have really bad anxiety, so they start using cannabis to reduce the anxiety, right? They start using cannabis to reduce the anxiety. But now, when they don't have cannabis, the anxiety is even worse than when they first started, right? So, what came first? The chick, or some people start using a substance, they become chemically dependent on it, uh, end up getting depression now because of it, depression or anxiety because of their substance misuse, right? So, it's kind of a co occurring thing that we're talking about, the chicken or the egg, right? Check the chat quickly. Do you have any episodes? Chronic stress compounded by surgery. Thank you so much for sharing, Robin. Oh, yes. Thank you so much for sharing, Robin. People rarely experience single mental health challenge in isolation, right? Anxiety, depression, trauma usually overlap with substance abuses or within each other, right? If you have chronic anxiety or chronic depression, they usually are overlapping with each other. You're worried so much and it's making you depressed and sad, right? Or you have such bad depression that now you're worrying so much about everything else and they work together and then snowball into something even worse, right? So we have to make sure that we're looking at person their whole environment, right? It's not just physical or mental, right? We got to look at their home. We've got to look at their finances. We've got to look at their past traumas, right? We are made up of so much different elements of our whole being than just our physical, mental being, right? So we have to look at people in a holistic response, right? Um, Sympathetic nervous system. So what we were talking about with that a little bit earlier is we have a sympathetic nervous system in us, our central nervous system, and then we also have our parasympathetic nervous system. So our sympathetic is responsible for fight, flight, or freeze, right? So if this tiger shows up into your living room right now or wherever you're working, your office, you're going to say, "Oh my God, there's going to be a spike in your heart rate, a spike in your blood, and you're ready to either fight that tiger and defend yourself, run away as fast as you can, or some of us freeze because we can't move. It's too overwhelming, right? Dilating pupils so we can take in more light and we are ready to fight that tiger, even if it's dark. We can get night vision kind of thing. And it gets our body ready to fight, right? And this has evolved in us ever since for millions of years, right? So we could battle those predators out in nature if there was a bear coming on us, or a wolf, or a tiger, right? We needed that system to make sure that when we're under threat, we're ready to fight and protect ourselves and our family and everything around us. So our modern day sympathetic system is different though. We have houses that protect us and we have this and that we're pretty safe individuals now. But now there's different threats, and different threats are chronic stress, high blood pressure, increasing your risk of heart attacks, because our modern day sympathetic nervous system isn't being triggered by tigers and things like that. It's being triggered by things that you see on your phone here or on your screen here, right? It's our phones, it's our tablets, it's constant dings on our phone. It's constant phone ringers. And then our email has a different notification. Texts have different notifications. Snapchat, the phone is ringing, right? Voicemails have different. So these things are constantly ringing and dinging in our ears, right? Um, and all of these kinds of things, even if you're getting bullied or maybe something's happening to you, say on social media, right? You look at social media and it's negative media all the time. Oh, Donald Trump is testing out nuclear weapons again. Oh, Palestine and Israel conflict, right? Russia, North Korea, Canada, this, political spectrum, that, right? It's constantly this barrage of negative media. And that feels to us like current day, modern day threats, right? And if we're on our phone 100 times a day, then we go onto our laptop and then we turn on TV for the 6 o'clock news, right? It's constantly bombarding us and we can't get away from it. And that stuff all feels threatening and it activates our sympathetic nervous system, which increase all of this stuff. It makes us stressed. It makes our blood pressure higher. Risk of heart attacks goes up, right? And that's what we feel today, right? And as a result, we have higher rates of kidney disease because this is always being activated, diabetes, obesity, we have difficulty depression, preeclampsia, we have difficulty with sleep, right? So we have to make sure that we're battling the sympathetic nervous system, these things that are activating it, by activating our parasympathetic nervous system. Our parasympathetic nervous system calms us down. It regulates our blood pressure. It makes us able to digest things. It balances our survival responses and it calms us in times of stress, right? So that's things like mindfulness, like you were saying earlier. Breathing activates that parasympathetic nervous system. A quick one right now I can do is box breathing, which is 4 seconds breathing in through your nose, 4 seconds holding it, 4 seconds blowing it out, and 4 seconds holding it out. Right? So it's 4 in through the nose, 4 hold, 4 seconds out, and then 4 seconds hold. And that activates our parasympathetic nervous system. Nature is another big one. Nature actually has something called phytoncides. Trees, grasses, vegetation emit phytoncides, and we breathe them in. And that also activates our parasympathetic nervous system, but that's a whole nother workshop that we'll talk about. Another way is to disconnect to reconnect, right? Disconnect from your phones, right? Disconnect from media, from social media, right? Um, if it's if it's causing you stress and worry to be on your social medias and things like that, and you're constantly getting all this negative media that's activating your sympathetic nervous system, making you stressed out, you have to cut that from your life, right? Or at least try to figure out a way to tailor it so it's a little bit more positive, right? Look at funny cat videos or something like that. I know lots of people do that. But just disconnecting from a little bit, getting away from it, cleaning your home, getting out in nature, having some fun, right? Some skills and strategies, breathing exercise, like we just talked, cognitive behavioral therapy based coping strategies, which is maybe another workshop, therapeutic counseling, right? Sometimes just going to talk to somebody, whether it's family, a friend, or a counselor, or therapist, or elder, or knowledge keeper, just getting your worries off your mind and talking to them about it, right? Lifestyle and self-care approaches. If your lifestyle is go, 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 maybe you've got to reassess your lifestyle and say, this ain't working for me. I've noticed my anxiety, my heart rate, I'm not feeling very well. You've got to reassess and kind of, cut the fat out of your life, right? If it's not working for you, trim it a little bit and make it so you're feeling a little bit better. Meditation and mindfulness practices, traditional ceremonial practices could be, having smudges, sitting with yourself, being mindful, seeing things around you, hearing things, forced nature-based therapy, right? Go out to the forest and just listen, right? You don't have to be on your phone in the forest. Just go and listen, and you'll start noticing your body is trying to tell you different things. Your mind is trying to tell you things. Your spirit is trying to tell you different things, but we can't tap into it because we're so distracted with our phones and everything. All of our other responsibilities could be our kids. It could be we have work deadlines, right? There's all of this noise that isn't allowing us to get into. We're always thinking in the surface level of our brain. We have to tap into our heart and our spirit, which are trying to tell you some things are ailing you, right? And when you can hear those things in peace and solace and silence of nature, then you can tackle those things and you're going to feel a lot better. This is a quick assessment. It's called the GAD-7. I pulled this one up because it can be actually used by anybody, right? It can be used by just a self-assess yourself. It can be used by clinicians. It can be used by physicians, nurses, healthcare aides, whoever you are, wherever you work. And it gives a quick little breakdown of what that person might be feeling, right? And you can take that. It's not meant to diagnose somebody with anxiety, but if they're at all threes on there, then you probably know, okay, they probably have a pretty bad case of anxiety. Maybe they should seek further medical assistance with a physician, a psychiatrist, a psychologist, and then they might get diagnosed with it, or maybe a medication, or get referred to a counselor, whatever it might be. Thinking with heart and not only mind. So this again is what I just said earlier, is reflecting, right? Slow down life. Life is so fast with everything. You have so many responsibilities. Sometimes you just have to slow down, be with your thoughts, right? Be with your thoughts, jot down what's worrying you right now. Make a list, right? Make a list of what's worrying you, jot it down, and slowly tackle things off that list. And if there's some things on your list that you don't have control over and you can't stop, then you have to accept those things as well if you can't control those, right? If there's things in our lives that we can't control, then we can't give them that much power as well, right? But jotting down a list, just seeing your list right away and saying, okay, how can I tackle that, will already create um, a lot more peace for you, because instead of it all being in your mind jumbled up and swirling, just like earlier somebody said on the coot, my mind is messed up, right? That's how it feels. Your mind is just all in this big jumble. Once you can put it on a list, you see it and you're like, okay, I feel a little bit better now. Let's tackle one thing at a time, right? Feelings that go unnoticed, that's what I mean, where we got to get out of our mind and think with our heart as well, just getting out of distractions. So before I close with everyone, I'm going to talk to you about the glass of water, right? We got about 8 minutes to the top of the hour, so we're moving okay. Sorry, I'm talking like an auctioneer here. There's just a lot to cover. There's a lot we haven't covered as well, but I just want to make sure we get through it all, and I hope you guys are learning something. But the glass of water. So a psychologist was teaching a seminar and walked around the room holding up a glass of water. Everyone expected her to ask, is the glass half empty or half full? But she smiled and asked, "How heavy do you think this glass of water is?" The students started shouting, "Oh, it's probably, 8 ounces, half a pound, 10 ounces." The psychologist professor said, "The absolute weight of the glass doesn't matter. What matters is how long I hold it for. If I hold it for a minute, it's fine. If I hold it for an hour, my arm will start to ache. If I hold it all day, my arm will go numb and be paralyzed. The weight of the glass hasn't changed, but the longer I hold it, the heavier it becomes, right? And that's just like the stresses and worries in life. They're linked to the glass, just like this glass of water, in my case, the glass of coffee, right? The worries and stresses that we have, the longer we hold them, the more power we give them and the more debilitating they are, right? We've got to let go of that glass, let go of that worry. If we can't, if it has no power or we can't do it, right? We've got to make sure that we're letting it go or we're putting the steps in place so we can let it go, right? So I think that's just a really good analogy of our stresses and our worries. Sometimes we give so much power to so little small worries, right? In the grand scheme of things, just like you were sharing a little bit earlier, pushing that grocery cart, hitting somebody and falling, right? That might make our whole experience in the grocery store anxiety inducing before we even get in there, right? Have we ever done that? Actually pushed our cart into somebody and fell down with it? Probably not. Most of us haven't. If you have, it's just a funny story to tell, right? Look at it as a funny story to tell, but don't give it all that power where every time you go into the grocery store now, you're worried, right? Or you're just not enjoying any time going into Costco or Save on Foods or wherever you go, right? Um, don't give it that much power. Let it go, just like that glass of water. Next slide. What we didn't cover today, biological factors, long-term trauma and attachment roots of anxiety, a lot of intergenerational trauma, things like that, that communities go through, cultural and social impacts, the effects of technology. We can jump even into more of that, screen time, chronic stress, burnout, compassion fatigue, lifestyle supports. I wanted to talk more about that as well, but like I said, these are all just lunch and learns for this month. If you have any other ideas, by all means, please leave it on our evaluation coming up. Anxiety in children, youth, and our families, right? Anxiety is contagious, right? It has a contagion effect and it can affect all of us. A recommended reading for everybody. I've read this book. I have it, not in my office here, but it's called The Anxious Generation. It's a really, really good book. How the Great Rewiring of Childhood is Causing an Epidemic of Mental Illness. Really, really good book. Go and book yourself somewhere and go into the bush or go on your flight or wherever you are. Just go somewhere and read this book. It's really, really good. And I'm going to close by giving you a quick quote with anxiety. So fear, the acronym of fear, FEAR, said by Zig Ziglar, fear has two meanings. You either forget everything and run, or you face everything and rise, right? So anxiety gets better by putting yourself out there, right? If you have fear of spiders, you're not going to jump into a pit of spiders. You're probably going to make it worse there, right? But if you see a spider, be with it. Try your best to be with it. You don't have to touch it even or anything like that. Maybe next time you see it, you can touch it or whatever, right? But be with your anxieties, be with your fears, and you'll become more tolerable because of it. You'll be more tolerable from those things. Get to that grocery store, push that grocery cart, even hit somebody. No, I'm just kidding. Don't hit anybody with it, but I think you get the idea of it. So thank you, Sheila. It says this is very helpful to teach me. Yes, thank you, Sheila. Uh, Erica, very good. Watching funny videos on TikTok. ASMR is very good. Yes, Reiki is very good. ASMR, very, very good stuff. I wish I could talk more about that. But you should check out ASMR on your videos as well. If everybody could take a quick, like probably take you 1 minute. It's just a couple questions and evaluation. It's right there in our chat, or you can use your camera and do the QR code. Yeah, it did fly by, right, Mary? I know. Thank you
Totally.
everybody for having lunch with me today. I'll be here again next Monday and the next 3 Mondays after this. Come and have lunch. What did I say earlier? Manger and motiver. Lunch and learn, brunch and learn, chew
Thanks,
and
Tyler. I think this is
review.
it's really important that we start having these conversations, especially post-COVID,
Yeah,
when we've
I
had
agree.
when anxiety just hit the roof for, everyone. And, we talk about grocery stores. I still don't even want to go to the grocery store post-COVID. It's just something,
Yes.
it's now almost like the anxiety became a learned behavior.
Yep.
Right? And I'm
Yep.
just as happy to order my groceries in now and not do the grocery store at all. And that's
Yep.
something I really need
Exactly.
to face, and I
Yep.
really need to really deal with, because I used to love going to the grocery store. It made me think about menus and planning and, what would we have this week, and, thinking out of the box. And now I'm just like, okay, that's on the order and it's coming and it'll be here at 2 o'clock or 3 o'clock. And so,
Yep. 100%. And yeah, just put yourself out there a little. Grocery delivery is pretty convenient,
yes.
but yeah, you definitely got to put yourself out there. Thank you, everybody in the chat. After practice, especially with it. Yeah, 100% Janet. Um, Erica said, I think it was Erica said she can't access the chat. Um, Kelsey put a link in our chat as well, just above you, Erica. If the QR code isn't working, then maybe click that one. Hopefully it'll work. Thank you, everybody. Like I said, I hope everybody learned something. We've got about a minute here. I hope everybody learned something. Next week, we'll be talking about depression. Um, and kind of what that all encompasses and kind of the misconceptions of depression and things like that as well. So, and then after that, I think it's seasonal affective disorder. And then the Monday after that, at the end of November, is grief and the holidays, right? So a little bit of grief and loss and things like that. So, yeah, join us, everyone. You guys are really amazing in the chats and cahoots. Like I said, we learn from each other if everybody's participating and being vulnerable, letting us know what works for them. We've all been through anxiety, whether it's an anxiety disorder or a pretty long bout of anxiety or depression or grief. It's good to learn from everybody. So, I want to say Chimigwich from Doris and I. Thank you, everyone. You are so amazing. And hopefully, we'll see you on Monday. Chimigwich.